Welcome all. I'm Adam Kaufman, part of the OSP team here, and we're very excited to have you join us for our webinar about AI-driven healthcare, really focusing on digital transformations and operational excellence. We're very excited to have Rob MacNaughton join us. He's an accomplished technology executive, investor, advisor. Actually was recognized as one of the top 50 people in technology in 2020 by the Healthcare Technology Report. And I think you'll see as we have our conversation that he's been on the AI journey for longer than really any of us, from before we even knew what these words meant to now leading one of the companies at the bleeding edge of it. This is part of the OSP webinar series. OSP, as many of you know, is leading in technology development and excited to bring these discussions to you all and to everyone else. We're going to go about 45 minutes, Rob and I, in a conversation. Please, if you have questions, use the Q&A feature in the webinar, and we'll get to them towards the end. So Rob currently is president and COO of SkyPoint, where they help organizations harness automation to enhance efficiency. Rob brings a practical, results-driven leadership. I've known Rob many years, and I can say that he's one of the best thinkers, both at like a high-level strategic, but also like how do you actually make this work on the ground. So Rob, welcome. We're so glad to have you with us today. And like always, we'll turn it to you just to tell us a little bit about your background, how you got to what you're doing. Tell us about that personal experience.
Well, thank you, Adam, and thanks for the kind words, and great to see you again. Uh, my healthcare, I guess career journey started, over 20 years ago. And, as you and I have chatted a few times, I've been chasing some white whales in healthcare for over 20 years, mostly around improving the patient experience and reducing total cost of care. I've spent my career, I'd say, at kind of the intersection of technology, operations, and healthcare, working with providers, payers, health tech companies. And as I reflect back, that mix showed me how often, the real problem isn't the lack of a solution, or in today's world, the lack of AI. It's really stemmed more from fragmented data and disjointed workflows. And over, I saw frontline teams forced to work across 10, 15 different systems just to answer a basic question about a member or a patient or a task. And what that meant is that more throughput through these less than efficient workflows was just turning into greater burnout, and frankly, burnout and friction amongst our most treasured clinical resources. And that experience convinced me that data unification, so really creating a single trusted view across systems, is really the foundation of anything meaningful. And now we talk about it in terms of AI, but frankly, it's been an issue in healthcare, as you know, for years and years. And so I also learned that technology only works when it's embedded where the work actually happens, right? And that's why I believe, today designing AI and automation that actually fits into the current operational and clinical workflows is key as well. And so, unless you have that data unification and that seamless workflow integration, scaling solutions is difficult, and that's even the case today in AI, and perhaps even more so. So, my journey now is really focusing on operationalizing AI. It's tying it directly to the business and clinical outcomes and making it repeatable, scalable, and frankly, safe as well. And so, ultimately, I think the solutions that we have today that are harnessing data unification and AI are one of the few levers we have in healthcare that can improve patient outcomes and reduce total cost of care. So for me, this is definitely aligned, I guess, with my own personal mission, if you will. As it's been a long journey on this white whale chasing.
Yeah, for those of us who have been around technology and healthcare, it does feel like a lot of white whales. Occasionally someone will catch one, but I think we're and occasionally they regret catching it. But it's been a tough journey. Before we're going to spend a lot of time talking about the specifics of sort of data unification and how that enables AI. But before we go there, you're one of the few people who have worked at really, really large organizations, including one of the largest and leading health plans and startups. I'm wondering if the challenges that you're seeing and the opportunities are different by size of company or maybe where they live in the industry, or is this sort of across all players?
I think the needs are pretty common, or at least they rhyme across, all the whole spectrum of healthcare. So as you noted, 10 years ago, I was working on augmented and artificial intelligence implementations for a regional blue player, a multi-state blue player. And the goal was, again, a unified view of data in order to improve patient and member experience, healthcare outcomes, as well as reduce operational friction, create efficiencies, and drive financial shape. And back then, I had budgets of tens of millions of dollars to do this with dozens and dozens of people. And the teams I was working with, we were working on, I'll say, the precursors of Gen AI. So think neural networks, machine learning, natural language processing, robotic process automation. Again, kind of the building blocks of what we think of Gen AI today. And so, as I think about the things we're doing today, it's very similar from a goal and aspiration standpoint, but the speed in which we can now do this is so much faster. The cost of which we can do this is so much lower that, things that were, truly only in the bounds of like large national payers or health systems. They were the only ones that had the financial wherewithal to do it 10 years ago. Quite
Right.
literally, you know, most, if not all, healthcare organizations can do that. And today at SkyPoint, we focus on community care. And so we focus on sectors of healthcare such as regional and rural health systems, regional payers, federally qualified health centers, provider groups, skilled nursing, senior living, as well as home health and hospice. So again,
Yeah.
typically areas and sectors of healthcare that were underserved and underpenetrated when it came to technology, largely because the costs to play were just too high at the time.
Yeah.
That's now changed fundamentally
Let's
today.
maybe we double click a little into that sector because I know some of the audience will know that, but maybe some not as well. So those are typically smaller organizations. Revenue streams are not as strong, to be euphemistic about it, compared to some of the others. So, but are there differences that make technology harder, easier, more important, less important than just size and scale for these organizations?
Well, you know, each each element of healthcare is uniquely different, and that's why we try to focus on, I'll say, those verticals I highlighted, because
Yeah.
there are some commonalities across, like the need for unified data pervasive throughout, and so that is something that most organizations, you know, there's an opportunity there along their journey. But depending on the reimbursement model, the members they serve, and the patients they serve, there are going to be unique needs and use cases that are going to be more relevant for them. And that's kind of why we have that sectoral focus. For instance, for FQHCs as well as regional and rural health systems, they might have a higher proportion of their revenue be Medicaid dependent. And so, certain use cases around redetermination and UDS
Right.
reporting are more prevalent. But for providers, let's say, and regional health systems, there's a lot of administrative complexity and friction, particularly around things like prior authorization, denial and appeal management, scheduling. And so, we focus on a lot of the front office and back office automation things that frankly just drive up cost and consumer and patient frustration.
Yeah. And that seems to be a pattern in most clinical organizations that are still broadly reimbursed by time spent or an actual person doing something that there's more opportunities to improve the administrative side,
Mhm.
and it's harder not only to do because there's concerns about efficacy and outcomes, but just the way reimbursement is tied to 15-minute increments or getting something done make it harder to automate um, the care side. Is that true for these providers and these kinds of organizations as well, or are you seeing real transformation on the care side?
We're seeing transformation on the care side, but in general, when you ask members and patients around their care journeys, there's usually fairly high satisfaction of when they are in the room with a clinician or when they are in the hospital. Yeah, most of the friction and distemper is around access to care, billing and collections, paying for the care, and sometimes some of the follow-up stuff. And so those are areas that, are almost non-regrettable to focus in, no matter where an organization is along, their data journey or their journey from fee for service to value-based care. There's still a lot of opportunity just with those, I'll say, more administrative functions that, can be automated, but have to be automated thoughtfully.
Yeah.
Um, and then we work with, provider groups and ACOs that, have a far more value-based orientation to them. And we have solutions that essentially act as sidekicks to clinicians at the time of care and point of care, surfacing information, because again, we have it in a unified high trust R2 certified environment that allows them, again, at the point of care and at the time of care, completely integrated into the clinical and operational workflows to surface informations around gaps in care, risk stratification, social determinants of health, et cetera, which, are powerful levers for those value-based oriented relationships.
Makes sense. Let's step back a second. You've talked a couple times about the importance of kind of integrated data. Define that for us. Like, what do we mean by that? And then we can talk about why it's so hard to get there.
So thank you. I appreciate diving on that. Our philosophy and viewpoint is you can't be an AI company unless you're a data company. Uh, Having that unified view of all the data essentially allows you to take, all the data that you have in disparate systems. And typically when we've thought about unifying data in healthcare, it's just been, claims and EHR. But, with the approach now, it's you can bring in all other kind of systems and data, whether it's your HR system, your customer relationship or patient management system, purchasing, compliance, structured and unstructured data, all together into this unified data lake that is, protected, and we denote high trust R2 certification, which is the highest level of HIPAA protection, cybersecurity, data partitioning, et cetera. And once you have all that data together, you're then able to surface KPI dashboards that are linking data that you've never had before. And so you get unique, views and insights by, linking data, whether it's a 360-degree patient view or member view. And, then you're also
So
able
if,
to, oh, go ahead. Yeah.
yeah, I wanted to press on that a second. So as we think about, for lack of a better word, like multiple systems of record, right? So the EMR is one system of record, the claims is one system of record. You may have a customer support tool as another system of record. Give me a sense of scale. Like if you went into a regional qualified health center, like how many of these systems are we talking about trying to unify to get a single view of the patient?
So we typically do it in waves, but it could
Okay.
be 10, 15 different systems, right?
Okay.
And again, some organizations have done, more work with regards to unifying EHR and claims, but
Right.
then the layer. And some we have to start as, that's the start. So, but you can
So why
essentially,
is that so hard to do?
well,
It's a
largely,
leading question. I know part of the answer, but I don't know the full
I mean,
answer, and I'm curious.
enable, it's one thing to do it, and it's one thing to do it and have it and be able to utilize it. So
Okay.
typically the cost of bringing all that data together without the tools that have been developed over the last 3 or 4 years, heavily manual, and the costs and to get it so it's high trust R2 certified, so you can actually use that data.
Right.
Again, it was really within the bounds of just the largest companies with huge IT teams and
Right.
budgets. And so the cost of doing so, again, SkyPoint's been around for 5 years, and we've invested, the first 3 years of our life cycle, purely focused on the data unification side of things. So building
Yeah.
all of our internal systems, tools, and processes, building connectors with 250, actually close to 300 healthcare IT systems across those verticals.
Yeah.
Um, Being able to write the rules, and then being able to consolidate and unify that data
I'm
in
smiling
our
because
high
just the
trust R2 certified
connectivity of all
environment.
these
Yeah,
systems is a hard exercise.
yeah,
And then normalizing that, I'm doing some work with a health system now. And one of the things is just matching how we think of like a membership file to a patient file. And like, how do you know it's the same person or not, which is a classic problem across any of this, right? But now you've got 10 or 15 systems doing this simultaneously. So have you all utilized AI to make the connectivity easier and that, for lack of a better, normalization, or like where's AI living in the data unification stack?
so Yes, we've, because there those relationships that you talked about for that given healthcare organization, like again, it might not be the exact same for another organization, but there's similarities. And
Yeah,
AI is great about repetition and routine. And so you can, do a lot of front end work through AI. And then, then of course we have human engineers that come in and ensure everything's right. But we built a lot of automated tools to help with that matching, that cleansing, and that unification side of things. And
yeah,
again, it all has to work in this high trust R2 certified manner, such that we have confidence that when the output comes out, that it is protected, clean, and kind of ready to go and ready to scale.
yeah.
Um, the other area in which we leverage AI quite heavily is actually on the specific integration into the workflows of a given client, right?
Okay.
So, one of our big theses at SkyPoint is that how software is bought and consumed in healthcare, as well as other verticals, is going to change over the upcoming quarters, right?
Right.
So if you were a healthcare, leader, decision maker, and you were going to be utilizing a software solution, over the last 20 years, the process has been you pick your SaaS-based provider, then you choose a systems integrator, typically another company, who comes in and works with your teams to essentially tweak your systems, tools, processes, and workflows such that you can utilize the software. Because
Yeah.
the cost of integrating the software into the current workflows was too great. It just could
I'm
not be
smiling.
done.
My very first job was to turn on an ERP for a retailer. So
Right.
it wasn't
Yeah,
healthcare, but it
exactly.
was like, this is what
Yeah.
it does. Which of these seven options do you want?
Yeah. And you would do some configuration, but it wasn't customized. And many times the client had to make pretty massive changes to their ways of working in order to utilize the software. Again, just because the cost of the incremental software engineering needed to truly customize it was too great.
Correct.
Your only other option was, frankly, a true custom build, right? Where it might be, and in the case of healthcare, a multi-billion dollar effort to customize the software to your needs. Those were your
Yep.
two options. With AI engineering and with SkyPoint in particular, how we deploy is we have like all the foundational elements of our data unification, and we built a catalog of probably 30 to 40 different AI apps and agents that address use cases across those verticals.
Yep.
Um, and then that software is deployed with what we call a forward deployed engineer. It's a bit of a misnomer because they don't need to be software engineers. They think of them as like solution architects.
Right.
So they understand our software, but more importantly, they understand the software of that given vertical. So they
Yep.
understand who the main software players, the integration points. They're technologists, so they understand, what those integration efforts are like. But just as importantly, they also have the business context as well. They work with these
Yep.
leaders so they understand what are the key KPIs, what are the key drivers of the business, what are the strategic imperatives for the business.
Yep.
And the primary goal, particularly as we implement the software, is to determine how best can we tweak our software to integrate into their systems,
Right.
tools, processes, and workflows. So it's fundamentally a
Yeah.
180
So,
degree shift.
so first, I think it's really compelling, but let me play devil's advocate for a
Yeah.
second so you can tell me, and then we'll get to how you would advise companies either working with you or others to get to AI. But one of the things when you bought one of those major systems, whether it's ERP or the EMR, was particularly at the executive level, you tell you, okay, we're buying best in class software, but we're also buying best practices, right? So they're going to come this implement and tell us this is the right way. So the example I always use is like, this is the right way to pick and pack it at a warehouse, right? Like each company might have their own way, but like there's some science about how to do it. So you'd buy here's the shelving. And in this model, are we losing that? And if not, because it sounds like the cost of this is that we can kind of do everything, but now the customer and you guys have to figure. So where does that sort of best practice piece come in? How do they know they're using it the right way or that's the place to go?
So great question. Um, you know, I think I think it's a bit Pollyannish to think there's a best practice that applies across all companies, across one vertical. Because again, serve different, they may serve different regions, different members, different patients. They may do different things. So having a best
But
practice.
let me challenge you a
Right.
little bit. I imagine there's a better way than how most people do it to do prior auth, right? Because it's really a function of, I mean, it might be different by payer, but like somebody knows the best way to pick up the phone and call the particular blues plan, or to send, or to get this approved. I agree with you, but I'm pushing
Yeah.
you on some of these administrative workflows that seem like there's best practices that I'd want you to bring
So,
to me as well.
so fair. So there's a friction. So backing up, our
Yeah.
viewpoint is that you will get greater nearer term impact if you're integrating into the current operational and clinical workflows.
Okay.
So if we go in and our solution takes their current workflow and improves it by 50, 60, 70%, that's non-regrettable, right? Like,
Right.
could it be done better? Yes. The great thing about, our software is that it's pretty malleable as well. So,
Yeah.
as I mentioned, when these when we do an implementation, we're trying to orient ourselves as the software partner to
Right.
tailor our software to meet those systems, tools, processes, and workflows. And we're able to do that because unlike SaaS, where it was all 100% human engineering needed to do that, a large portion, 50 to
Yeah.
90% of that customization effort can now be done through AI engineering. So
Yeah.
and the capabilities of AI engineering are expanding and growing at such a huge rate that eventually we think we're going to get to N of one software for a given client.
Yeah. By the
And
way,
so
oh, go ahead.
no, and
I'm
so
just excited by this conversation. So
so if you get to N of one software, that means that as the organization that you're partnering with continues to evolve their workflows, you
yeah.
can just keep continually evolving, the software to meet those workflows. So
Yeah.
I think from our standpoint, particularly within healthcare,
Yeah.
and if you step back and look at from a value creation standpoint, there's so much opportunity, particularly in front office and back office automation, that if you
Yeah.
can do that well, even if it's not a perfect workflow, you still get them much farther ahead in a much shorter amount of time by integrating with what they
Yeah.
currently do, and then allow them the opportunity to evolve beyond that.
And I think what's great about that is, like you said, most of these have a throughput problem in the current way they're done. So can we just gain efficiency in doing that? But then you're, what's the expression? You're sort of pushing the decision out to the edge. You've enabled
Yeah.
closer to the actual person doing the work to then start thinking about configuring it. So the question I would have for you, and this is one of the best examples we've heard because it's always true, is that it's not just a technology shift, it's a cultural shift. So how do you
Absolutely.
advise companies that have for years said, this is the standard operating procedure on how you submit a claim, to, okay, well, now there's some tech, but also we need to challenge you to think about how you might integrate, incrementally do this better because the tech is that malleable to what we're doing. Like, how do you help them make that cultural shift?
So absolutely. And a great thing about this type of software is that you can keep layering on use cases. It's like there's almost, again, when you have that unified data perspective, there's almost an infinite well of potential use cases that you can do
Yeah.
because you're just able to to measure and analyze better. So then again, a lot of it comes down to this forward deployed engineer role. They work with clients to essentially rank, prioritize what use cases are going to drive value for either operational efficiency, clinical outcomes, other financial and operational metrics as well. And we're able to deploy use cases pretty quickly now. But
Yeah.
like with all technology and frankly, strategic initiatives, it's probably best to use a crawl, walk, run framework where you test in with a certain group or certain geographic area, refine, and then once you're comfortable with it, then roll it out. So there's just that I'll just call a general standard process for rolling out initiatives or implementations. But we're able to essentially, because these forward deployed engineers not only understand the systems, but they understand, the key business imperatives for our clients, that they pick the use cases or the solutions that are going to have most immediate impact. And again, we tend to also look at those areas that today, have high friction, can be easily automated, and there's low downside risk. And so that's why we tend to, at least starting out with organizations, focus on front office and back office automation things.
So
And with
say more, you're going into an organization, how do you help them prioritize? Because what's great about this is it's not a monolithic, we're going to change everything at once. It all has to work the way, an EMR implementation, right? You're coming and saying, we got some work to connect the data. But once we do that, we can incrementally deploy, do you even call them an app? You call them a use case, I guess a use case that
yeah,
leverages that. So talk to us about how that prioritization goes in general. What do they need to think about to prioritize the right use cases?
I mean, so typically we think about high volume, low judgment tasks. So think things like eligibility checks, prior auth, data gathering, scheduling, even follow-up reminders, right?
Mhm.
They're not necessarily complex tasks, but agentic AI solutions do require some thoughtful design, and
Yeah.
as illustrated before, this unified data. So, and it's when you unify this operational data, whether it's calls, tickets, claims, tasks, you can see where work gets stuck, and you can then prioritize the automation that really matters and then can drive the outcomes. And so, teams, particularly when working with forward deployed engineers, they can observe how staff and patients interact with the systems and design automations that really feel like an extra set of hands to kind of push things along. Of
Yeah.
course, we maintain human oversight for decisions that impact diagnosis or care plans, health equity. But and then you then want to align those initiatives with business and clinical objectives, right? So whether that's operational and clinical scorecards, P&L metrics. You want to anchor the AI work to those outcomes. And so again, the data unification and the the prioritizing of use cases, it's really a strategic initiative. It's not a side project. And you want to measure ROI from day one. And the great thing about these use cases, when you launch them, again, if you do in this crawl, walk, run framework. If it doesn't work, just pull it back. No harm, no foul. It's these things are
That's really
you know
interesting.
there's a lot of composition you can do just to kind of add if you test and learn and it doesn't work, just pull it back. But I think your question really stems down to just the trust of these types of solutions, right? Having spent 2 decades in this, I will tell you that healthcare innovation happens at the speed of trust,
Yeah.
right? Um, and so, you know, for the reasons I mentioned, we focus on front office and back office automation typically, so people can gain trust without, really a lot of downside impact on things that really matter when it comes to care delivery.
Yeah.
And then, as we've built our catalog of solutions, we're moving more into things that enable and augment care delivery. And, the the building of the trust of clinicians is key and paramount. And then it's a matter of picking which use cases do you believe can not only drive on operational or clinical outcomes, but really also augment when it comes to those trust and credibility factors. And one, we call it kind of a Trojan horse that we use is the ambient listening or scribe solutions.
Hmm.
For many clinicians, these are game changers for them. It cuts down on their administrative
Right.
tasks by a material amount, right? They can save hours in a day, and it's these scribe solutions have gotten really good, such that clinicians are gaining comfort with the note taking,
Yeah.
um, and and the records, and they trust it, but more importantly, it is having a meaningful impact for them. And that builds trust and credibility. Then you can start layering other tools. Again, from our standpoint, we want to be a sidekick when it comes to the clinicians as opposed to, automate a clinical task.
Yeah. Really compelling. I just want to invite the audience to send in your questions. Rob and I will go maybe 10 more minutes. I've got endless questions. So if you don't have any, don't worry. I'll keep going. But we do want to make sure we get to any questions from the audience. Um, that's a really compelling example, Rob, of the AI scribe. I'm wondering, probably without violating any privacy of the organization, can you share an example or two more where you've seen this, maybe some skepticism to start, you tried a use case, how it fit into what they were doing, and that has built, more trust to do more.
Well, frankly, that's a journey.
Yeah.
That's a pretty typical journey across most of our providers, or in health systems and just frankly most of our implementations in general.
Yeah.
And that's why we're very thoughtful and intentional about, what are the key use cases. It again first just starts with the data unification, and I realize I'm sounding like a broken record on that,
Yeah.
but you know the visual manifestation of that effort is, um, you know a pretty comprehensive dashboard. And it just allows them to look at data that they've never had an opportunity to look at before. And then we can also layer on predictive analytics to help them gauge, if there's, any potential strategic issues based on the data and how the relationships between things working today in their current operating processes. So as an example, working with a health system, unifying their data, and again, EHR claims, no problem. We brought in some other elements, one of which was a purchasing system. And so, as you can imagine, procurement behavior is driven by, when they think they might get a good deal on something and cost per unit, and so they buy. This particular organization didn't necessarily tie the purchasing with consumption, because consumption was actually measured in other systems, some of it actually even in the EHR. And when we think of when we think of data unification in healthcare, we don't really necessarily think of tying EHR with
Or
purchasing
you don't think of
systems.
the supply side of the
Yeah. But
consumables or
as you can imagine, we within a matter of a couple of days or weeks put together an inventory management dashboard, KPIs. And as you can imagine, you can become a lot more thoughtful and intentional with spend if you can
yeah.
combine purchasing and
And that's a
consumption
real working
behavior.
capital issue if
And
you
that's
can
a real
solve.
work account. And if you're a health system, you could save, a point, right? And a point matters in
Yeah,
a regional rural health system. And so that's just an example of, the power of unifying data that organizations have, but just haven't really had the opportunity to tie in before. And again,
that's
that
really
can build
powerful.
trust.
And
And
that's even
again,
before you've now put a tool to say purchase more efficiently or,
absolutely.
project or predict utilization. So, that's even before you put automation or
That's
intelligence on
exactly right.
top.
That's just the power of having like the KPI dashboarding, which again is that visual representation of the data unification.
Yeah. Um, I'm curious, you mentioned, and I think it's a provocative statement, so I'd love for you to join that you think the way software will be bought and sold is going to radically change. Can you say a little bit more, maybe give us your sense on how it's been for the last couple decades and how it's evolved as it is and where you see it going?
Absolutely. So as I highlighted, in the SaaS-based model, you work with systems integrators, you're tweaking your tool systems and workflow to utilize the software. There's the routine of quarterly or annual patches. It's difficult to customize on top of it because you really can only advance at the speed of which the underlying SaaS-based software is developing. So the ability to customize and do continual tweaks to meet your needs as you grow and evolve, somewhat limited. And then, from a financial standpoint, you're usually obligated to 1, 3, maybe 5-year software agreements. And that might not even include the systems integration that comes from a different entity. So go forward, I think software will truly be N of one software where, we'll get to the point where we essentially have unlimited coding capacity. And so you can integrate and customize softwares to the unique, again, systems, tools, and workflows of a given client. And as the client's workflows evolve and needs evolve, so does the software. You don't have to wait for quarterly updates or try to influence the roadmap of the underlying software. That coding just happens. And as business needs or clinical needs arise, you just add on another use case, another app, another agent. Each one would have its own unique business model tied to it. Typically, those business models will be structured as win-win, and also be designed to be instantly accretive. And we see a future in which all software is essentially month to month. There is no need to get into year-long or 3-year-long agreements. And we think that's pretty powerful and a very different kind of fundamental philosophy than what we see today. And
So just because I'm somewhat naive to this, is that sort of taking the way people buy, compute power and hosting and sort of your AWS, your Azure, and sort of extending that into the software stack where you're sort of like, I'm going to turn this thing on, I'm going to construct this, I'll hire a company that does this piece really well. Is that sort of the future you're imagining then?
Essentially a Skype, like, yes. So,
Okay.
their data is attended on our infrastructure, and we take care of kind of all that stuff for them.
Right.
And so, yes, ultimately that's kind of how we see it going. And we see the need even popping up today. So
Yeah.
what we have seen in healthcare is that, many CIOs and CEOs, they they're having a difficult time, and rightfully so, of cutting through the rhetoric and hype, in
Right.
particular around AI in healthcare. There's a lot of companies that I think are masquerading as AI that aren't really AI. They may have a good use case solution, but they don't really have the underlying data unification chops. And so if you
Yeah.
go that path as a healthcare leader, you may step back and, 1, 2 years later, you just find you have a patchwork of kind of, untethered use case solutions all around your organization.
Right.
And that there's going to be a complexity to managing that. So got to cut through the hype. You got to find those partners that really understand, I think, the data unification side of things. Now, as a healthcare leader, you may not fully understand a lot of the fundamental foundational aspects of AI technology.
Yep.
But you do know it's moving very, very fast, and it can
Yeah.
have a lot of strategic value and input. And many healthcare leaders are getting mandates from their boards to go dive into this stuff. And so, as a healthcare decision maker and leader, you're in an awkward position right now where you may feel underinformed. You're not
Yeah.
sure who to trust because there's a lot of rhetoric and hype. You know it's moving very, very quickly, and there's a lot of
Yeah.
opportunity out there, but you don't want to get into a 1 or 3 or 5 year relationship with someone either. And so, having this kind of go-to-market motion where you can come in and essentially, for really low stakes,
Yeah.
try it, see if it works, and then build up that relationship. And that's kind of, how we have moved our go-to-market motion. And we think that's just going to be where the industry kind of goes.
One of the things I'm curious on that model, particularly, so this is both a who does what in it, but also then what's the skills that you think the health systems and plans need to build is, um, it seems to me a lot of that works with, for lack of a better word, call it headless systems, right? It's the logic chain, it's the data unification. Who's building the interface then? And is that now a skill that you think the system needs to own because you've essentially made it so flexible that can they put their own interface, and so or are they hiring people? Are you building the user interfaces of these apps? Who's doing that piece of the experience?
That's a great question in terms of like a competency and capability
Yeah,
standpoint.
and where does that live in this world of sort of on-demand software?
That it's a great point. So, if we think in the SaaS-based world where you looked at where the talent pinch point was, it was
Right.
software engineers, right? And there was a lot of different strategic ways that people try to reduce that, whether it was, offshoring, there's a lot of ways that people tried to make that, that talent pinch point less, but it was still pretty prominent. Going forward, with regards to data unification and agentic AI, my belief is that talent pinch point will be this forward deployed engineer role. So that competency and capability of understanding the technology, being that solution architect, but also being steeped and experienced enough in a given vertical to understand the business context,
Yeah.
right? The systems and tools and technology of that, specific vertical or client type, as well as what are the strategic imperatives, what are the KPIs, what are the things keeping the decision leaders up at night. That is going to be the critical resource, and that's going to be a challenging one to scale. Now, you know, for companies like us at SkyPoint, that is, we're investing in that competency and trying to really build that up. I suspect over time, that will be an area in which larger systems and plans or larger healthcare organizations will try to bring in-house, much like they tried to bring in IT software
Yeah.
development.
Interesting. Yeah.
Um, so
This one's a
it'll
little
be
easier to argue because it sits closer to the business problem, but
correct.
yeah.
But it's I think it's inherently a more difficult thing to solve for, just given
Correct.
it's a mix of unique skill sets that really have not been
And it's
built to scale.
also just, as we're talking about, it's one that is harder to automate because by definition,
Right.
it's a connector across things.
Yeah. Yeah. Agentic AI needs data as well as it needs business context, context windows, context frames to, to how best apply it.
Yeah,
You know,
really interesting.
AI, that context is really important because AI solutions, if left unfettered, right, they're often wrong and never in doubt.
Yeah.
And so you need to have that business context.
Do you see this happening outside of healthcare? Is it already happening faster in other industries? And we're just coming late, or we because of how many data come in and how broken the administrative
Yeah.
processes are, we're actually leading it for once in technology? I'm curious.
So I see this happening across all industries, all sectors.
Yeah,
Interestingly enough, healthcare, which has, I think, largely been seen as a slower adopter than other industries
yeah,
with most innovation in the past, healthcare is actually an early adopter of AI. And I think it's largely because of the fact that healthcare has a higher degree of administration, regulatory, and legal compliance aspects. There's just a lot of opportunity to automate, and so with that greater opportunity, I think comes a greater appetite to start earlier. Also within healthcare, given some of the regulatory and legislative changes over the last couple of months, it's also spurred certain healthcare organizations to do something very quickly because
yeah,
how they're, the ways of working today are not going to succeed going forward. So it spurred them to move really quickly. And we're seeing that in sectors that, again, even within healthcare, that have typically not been, early adopters, whether that be FQHCs or
right.
skilled nursing and senior living, they're actually adopting uh, the AI solutions, I think at a much faster rate than other like industries in general.
That's really interesting. We have our first question in from the audience. So Dana asks, and it'd be interesting to know if you think this is sector dependent, but so what are the couple places where you see AI having the biggest operational impact in the short term? So call it the next 2 to 3 years.
Yeah, it's again, I really think it's going to be on those high volume, low judgment tasks that create a lot of distemper, not only internally with healthcare resources, but also with patients and members. So again, think things like eligibility checks, prior auth, scheduling, follow-up reminders, and we've already seen, I will say some um, earlier generations of technology, tackling those like robotic process automation and things like that, because there's just so much opportunity in healthcare. And again, those are where the pain points are from I'll say a member or patient relationship. Just to, again, put it into context, we held an AI summit earlier this summer where we brought in CIOs and CEOs from health systems and payors. And, you know, it was, we were kind of shocked to learn that 30 to 40% of a payor or health systems IT budget was spent specifically on systems or related to compliance and regulation. So there's just, again, so much opportunity there to streamline that I just think that's, going to be one of the first places that, business leaders look at. And again, it also is just a lower risk profile as well.
Yeah. So Saul asks, I think, an important question, which is, okay, so there's this real need for AI. There's a lot of approaches to it. How would you advise leaders um, to think about what to look for in a technology partner, right? What are the characteristics of the right partner? I like you're saying that, maybe you're not making a 5 year or 50-year commitment like you would when you picked your EMR vendor, but you're still making a commitment to a vendor. There's an opportunity cost. You are locked in for some period of time, nothing else, because you're not going to do it with more than one. So what are the key things that they should look for?
So again, when you're thinking, if there's been a mandate and or you're looking for AI solutions to help augment business operational and or clinical performance, it's not necessarily starting with AI. You're really starting with the foundation of unified, clean data. And so again, there's a lot of rhetoric, a lot of hype out there. So, my guides would be focus on proven players. Again, those that don't tout the glitz of AI, but more importantly, have the experience and the chops around the foundational efforts required for data unification. I think that's the key element, because doing that is just non-regrettable. You need that foundation first. You start with AI first without doing, I'll say, the more foundational work. You'll end up in this situation where you just have a bunch of untethered use cases that are going to be incredibly hard to manage and evolve, go forward, because there's not
But that
a kind of
unification, do you do that in sequence? So, this example, which I thought was a great one about purchasing. Now, maybe you needed to put everything together to see it, but couldn't you also say, hey, we're concerned that our purchasing isn't connected to our inventory management. Let's just connect the systems that do that. Let's look at that first, and then we can connect the others? Or do you think it needs to be a project to connect 80, 90% of the data and then look where to go? So maybe this is a sequencing question between.
again, I would say for most healthcare organizations, being able to integrate claims and EHR data is probably job one. And then it's just a matter of, what other systems go. And sometimes it's the speed of which we can integrate the systems. If it's a system that's, used pretty prevalently, we can fire those up pretty quickly and integrate the data. If it's an old system that might not be supported anymore, and it's, it
Someone's
might
got
take a
an
little
Excel
bit.
sheet
Yeah,
tracking this stuff somewhere, right?
yeah. But again, we can do structured and unstructured data as well. So there's, I think part of that mental math is just the speed of which it can happen as well, and
Gotcha.
that's going to be dependent on a client by client aspect. But again, I think you just look at where the data resides in the organization and try to just do those big rocks first and just get that unification together. But I think to the early point, you got to think in systems as opposed to point solutions. You want to build essentially an AI enabled operating system that's responsible, data driven, and yet human centered. Again, I think you then want to thoughtfully think about which use cases make sense at what time. You want to tie every initiative to a measurable business or clinical outcome. And again, not only the tangible value that we talked about, but also, there's going to be cultural adoption and trust coefficients as well that you want to take into account, because, sometimes in healthcare, again, it moves at the speed of trust. It may behoove you to go slow at the outset to move fast later.
Yeah.
And I do think that forward deployment skill set and competency, that is going to be core to success go forward. So, embed with, you want to have your teams embedded with that capability, whether you partner with someone that has that capabilities today and then kind of grow it over time internally. I think for most organizations, that's going to be the path. It's hard to build that competency around forward deployed engineers that understand the technology and the business context overnight.
Yeah.
But yeah, I think for most organizations, this means partnering with a proven partner and being thoughtful about the deployment of a given use case in that crawl, walk, run type framework.
Yeah, and I think that leads nicely into Hannah's question, which is sort of how do you modernize this tech stack, introduce AI without disrupting the mission critical operations, which I would argue is both the people that are doing those things so they're not disrupted as well as the systems themselves.
So what's really interesting is that we're not necessarily modernizing the system. It's still the same systems. We're just unifying the data into a usable, scalable, high trust R2 certified environment, which you can have confidence that you can use the data. So it's still the same underlying foundational elements of a company. It's just now being able to use the data that's been typically siloed, over years, if not decades. And then it's it's then picking those use cases and rolling out in a manner that is actually consistent with their existing systems, tools, processes, and workflows. So in some ways, with this newest technology, it doesn't require that huge kind of revolution, chaotic change of, swapping out one system with another system that required all new, you know, technology, maybe even hardware, as well as new systems, tools, processes, and workflows.
Yeah.
Even though it's a fundamentally different change in how things are done from a I'll say a clinical or operational efficiency standpoint, it may feel more evolutionary just because it is the same systems, the same data, just organized and unified, um, integrated into the same workflows.
So maybe to put that question slightly differently, because I think what you're saying is you're still running your core applications. We
Yeah.
haven't disrupted any of those. We're pulling something extracted. We'll do something to that, and then we're essentially trying to put back the output of that into the system in the workflow you're in. So my experience and full transparency, I haven't worked with SkyPoint, so maybe you'll tell me this is just a legacy, but there's a cost in time and money to unify the data, to run the new thing, to make sure the data lake worked, to then put it back in. So maybe the question to think about this from a cultural and a business standpoint is how do you help organizations justify it's going to take us a little bit longer to solve this problem by connecting data, solving it and putting it back in than just whatever it took to do it right already in the system of record better.
So essentially, the cost of doing that and the time of doing that is just much, much different. Like efforts that 5 years ago would have taken tens, if not hundreds of millions of dollars in months, if not years, now are being done for tens to
And
hundreds
when you
of
say those
thousands.
efforts, you're talking specifically about the data
Yeah,
unification
the
effort.
data unification
Okay.
side of
So
things.
where I
Yeah,
would have said, good, is I need this many people, this many years, let me go away and do this and I'll come back. That essentially is reduced in cost, so it shouldn't
yeah,
be a problem.
exactly. And so the incremental cost and time now necessary to do this is a fraction of what it was. And so particularly for business leaders and CIOs and CEOs that are familiar with the costs were, when they see
Yeah,
what the cost and time is now, it's usually a very compelling thing for them to go do.
gotcha. We got time for maybe one or two more. We've got one in from Luke. If you look out kind of 2 to 3 years, what do you see as agentic AI creating the biggest operational transformation? You've hit on a couple of these, so it's fine if they're the same, but is there some area where you're just like, hey, the next thing is this, and this is going to be the biggest thing?
My hunch is that there is going to be a lot more energy with regards to agentic apps and solutions around clinical care. Um, and I'm not sure how that's going to transpire, but I do believe that just given, I'll say, the hive knowledge of AI, that there will be, tremendous opportunities to help augment care delivery. And I think that will be a journey that we have along with with our with our clients, and it'll evolve very differently based on the philosophy of our clients as well. And so I think it's going to be a really interesting journey to see how some of this technology is brought to the fore. Um, for me, as I think about what that journey looks like, the thing I'm struck with most is just the pace and speed, the velocity of innovation and change is breakneck. It's
Yeah,
incredibly fast. Now, there's there's downside with that, like how best ensure and that you gate appropriately, particularly when it comes to clinical applications and use cases.
yeah,
But I sense there's going to be a lot of opportunity there, and I think part of it will have naturally just inherently good things when it comes to like health equity and access, like being able to deliver care cost effectively at a high quality in regional areas or areas that don't have typically strong access. I think there's the opportunity to lower the total cost of care, which again has some tremendous benefit from a health access and equity standpoint as well. So I do think if I think 3 to 5 years out, I think there's tremendous opportunity there. Just the pace of which will be guided by those that deliver the care.
yeah. Really compelling. I think we're almost out of time, so I'll ask my two always ending questions. So that was kind of 2 to 3 years. Take the hat off, look out 10, 15. What do you see as like some of the big differences in our healthcare, driven by this new technology?
The hopeful, optimistic part of me sees that
Please, let's
again.
let's get that
Yeah,
version.
yeah. Is that we've had a meaningful impact on total cost of care. Like again, that has been a white whale. I know many, 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 many others have been chasing for decades.
Yeah,
Um, and with that reduction in total cost of care, uh, I think that it just has tremendous opportunity for increasing healthcare access and equity. And ultimately, I think if done well and wisely, this will have a meaningful impact on patient outcomes. Um, my hunch is that if we look 10 to 15 years out, that the US will have a much better ranking in kind of the world healthcare status of healthcare outcomes with cost of care per individual.
Right.
Right now, the US does not rank particularly well. I would sense that the US would continue to move up in the rankings as we go through this path.
Yeah, I think it's great. We'll have to have another conversation, because so much of that cost is driven by the cost of procedures or
Yeah.
the therapies. So it'll be interesting to see how, as we make more efficient the operations of healthcare, make clinicians more effective, and the clinical care model, what happens to those procedures and therapies. Rob, this has been a real pleasure. I hope the audience appreciates just the change that you've been a part of and how much we've been able to do this, and really this idea that this is orders of magnitude cheaper and easier. Anything you want to leave us with before we let you go?
Just that I think we're at an inflection point at healthcare. And I do think these types of solutions really will have a meaningful impact. And I'm really excited what the next 6 months, year, 3, 5 years bring, because it does feel like yeah, that white whale I've been chasing is getting closer and closer.
Well, Rob, thank you again. To the audience, thank you for joining us. For those who had questions we didn't get to, we apologize. I always take that as a good sign that there are more questions than we have time to get to. There will be future webinars from the OSP team, so we hope you'll join us. We will, of course, give you access to this content as we get it available. Thank you again, Rob. Really appreciate it.
Oh,
And thank you to all who joined us. Have a great day.
well, thank you. Great to see you, Adam. Have a great day.